Hi everyone, my name is Victoria Daniel. Myself and my group members have a presentation today titled Children in Foster Care, a Vulnerable Community. And to do this presentation with me is Alberta Nyako and Abimbola Toye. Now, throughout this presentation, we'll walk you through our community assessment process, the issues we uncovered, and the strategies we believe are essential to improving the health and well-being of these children in the foster care. Now, moving ahead, we actually chose this topic because the children in foster care are usually one of the most vulnerable groups in Canada. According to Belle Ketel in 2024, there are over 61,000 children currently in care across the country. These children often experience trauma, neglect, abuse, and frequent moves, which greatly affects their emotional, physical, and social development. One particular issue of concern here is overrepresentation of Indigenous children in foster care, which points to systemic inequalities and the need for culturally safe approaches. This group usually needs urgent advocacy, holistic about the community profile. Under the community profile, our assessment focuses specifically with foster children between the age of 0 to 18 years living in Ontario. In many cases, these children move through multiple placements before reaching adulthood, which disrupts their development and creates some kind of lack of stability and belonging. Services for this population are primarily managed by Children Aid Society, which is mandated to protect children, but often face challenges like high caseloads, limited funding, and staff shortages. Understanding who this community is and how they are supported is key to designing effective intervention that promotes long-term healthcare outcomes. Now, under assessment method, to assess this community, we use the combination of theoretical needs and assessment, and then windshield survey method. This allowed us to analyze both existing data and visible observable challenges in this community. Even if indirectly, we also conducted what we call literature review, and our insight came from the stakeholder interviews. We have stakeholders like the social workers, the mental health professionals. Now, we based our work on qualitative and quantitative data. The quantitative tools included analyzing statistics from Statistics Canada on child welfare, while the quantitative data came from the Child Mental Health in Ontario, which provided insight into lived experiences and service gaps. Together, this method helped us form a well-rounded picture of community needs and where support is most urgently required. Thank you. I'm going to be handing over to my colleague to continue this presentation.
Thank you, Victoria. Hi, my name is Albert Nyako, and I'll continue from where my colleague left. So, with regards to the data sources we use reliable and up-to-date data resource. First, we use Statistics Canada to understand the national scope of child welfare and population data. We also drew information from Ontario Association of Child Aid Society, which provided us provincial data on how foster care is administered, including systemic issues and gap in services. For the mental health data, we used Children Mental Health Ontario and Canadian Mental Health Association. These organizations highlight mental health trend, service access, and evidence-based approaches. We chose these sources because they are trusted, current, and directly relevant to our assessment. Now let's talk about the key issues in this vulnerable community. Foster children experiences multiple challenges. One of the most critical issues they face is mental health. Many of these children suffer from anxiety, PTSD, and depression as a result of trauma and neglect in their early life. Another important issue they face is instability of placement. The constant changes in caregivers and home disrupt a child's emotional growth and identity formation, which can lead to a long-term emotional and behavior problems. In terms of education, foster children often struggle to keep up. They face delay in learning and frequent unprepared for adulthood. These include not having the skills or support needed to transition into adulthood or independent living. All these factors point out to a system in need of more support and stability and trauma-informed practice. Moving on to the strength, challenges, and capacity building. There are several strengths in the community in relation to foster children. There are strong social work network, peer support program, and increased public awareness about the needs of foster children, which provide a foundation to build on. However, challenges remain, especially in the form of limited access to trauma-informed care and shortage of funds, which affect the service delivery. In addressing this issue, capacity building is essential. These include training of caregiver in trauma-informed care, expanding available services, creating mentorship opportunity, and also strengthening interagency collaboration. These strategies aim to enhance what already exists and develop systems that are more inclusive and supportive. Moving on to stakeholders, gatekeepers, and inclusion, effective community assessment must consider the people and the group involved. Our key stakeholder will include government bodies, schools, community organization, and mental health providers. Our gatekeepers will also include social workers, foster parents, and agency staff. Their cooperation is very vital for both service delivery. We'll also communicate through emails, virtual forums, and also youth advisory panel to allow collaboration and sharing of ideas. Most importantly, we will include the voice of the youth, especially for those who are often unheard. We will use peer-led focus group and on animals feedback survey. This method can create a safe environment where youth feels comfortable expressing their experience, needs, and a suggestion. Thank you. I'll hand over to my colleague to continue.
Thank you, Alberta. My name is Atoyi Abimbola Oluwaseyi, and now I'll be talking about our assessment strengths and ethical consideration. Our assessment approach is built on three key strengths: it's structured, evidence-informed, and collaborative, ensuring that we gather comprehensive and reliable data. However, we acknowledge certain limitations such as limited direct contact with some of our participants and potential cultural gaps. To mitigate this, our work adheres to strict ethical standards, maintaining confidentiality, securing informed consent from all our participants, and showing deep respect for indigenous cultural perspective throughout the process. Moving on, in reflecting on our work, we've gained valuable insight into the complexities of foster care and the systematic challenges that underpins it. This process has underscored the critical need for robust youth advocacy and culturally competent care. Through collaboration, we have developed strong research, communication, and teamwork skills that have reinforced the value of community-focused, nurse-led assessment approach. Ultimately, these lessons highlight how essential it is to engage directly with communities to drive meaningful and sustainable change. In conclusion, foster children face complex long-term challenges that requires ongoing support. Nurses are uniquely positioned to lead community assessments and advocate for this vulnerable youth. By employing ethical, inclusive, and data driven strategies, we can make lasting and meaningful impacts in their lives. Thank you. And here we have some of our references. Our references continues here. Thank you for your attention.